very good evening to all of you. This is Dr. Manisha. I'm working as a medical lead in the Medical Affairs Division of Lupin. On behalf of my team, I extend a warm welcome to all of you. This meeting is basically arranged to have a brief discussion on patient awareness related to a patient segment affected with PCOS and associated with some mental illness. So, as we are aware that women are quite vulnerable to the mental health conditions in their entire life, and because of various reasons, either biological or environmental, social reasons, there are multiple periods where they feel quite depressed because of because of either disorders or physical status. So, Lupin team has brought this program, a small sessions for making them aware the importance of having managing these conditions along with their original physical disorders like PCOS. So here joining with me is Dr. Malvika Dahuja, who is a practicing psychiatrist in Amritsar. And thank you, ma'am, for coming and welcome.
Thank you so much.
So, ma'am, here we go with the first question. As we are aware that PCOS, polycystic ovarian disorder, is quite common in women, and the number of these patients are increasing day by day, particularly in quite their reproductive age group, or even in adolescent and young female patients. This is quite common. So, uh, there is also increasing evidence that this PCOS increases the risk of having some psychiatric disorders. So, what is your opinion? How these patients are commonly observed in your clinical practice?
See, when you already talking about PCOS, it is a gynecological condition. It already bears that a woman is feeling that she is not having that womanhood, that reproductive lifestyle. She is having irregular menses. She is having pain. She might be have undergoing social stigma. She might be undergoing infertility issues. This all, her body image, her concept of being self, her independent self, it's all losing. So, be it PCOS, be it any other gynecological condition, these are the environmental factors, obviously, which are affecting her. But to add on to PCOS is an endocrinological disorder, which also has underpinnings on brain. There are many pathways related to HPA axis, that is your endocrinopathies, and your neurotransmitters, which lead to PCOS. Alongside, there are so many other conditions in PCOS which make it a syndrome, which is a cocktail of it, like insulin intolerance leading to diabetes, inflammation. All this has evidence in literature that PCOD has neuropsychiatric correlation. The pathways of GABA are inhibited by the DHEA hormone, which is also responsible for cortisol release and release of stress hormones. And at the same time, it acts on ovarian hormones. And as we already know that PCOS is an hyperandrogenic condition, increased testosterone also leads to many of the psychiatric issues. So yes, it's not only important for the point of view that gynecological condition, it is a gynecological condition that the female is suffering, but also it has a lot of neuropsychiatric pathways leading to comorbidities of psychiatric illnesses in the same female who is undergoing PCOS.
Yes. So, as you have seen, the polycystic ovarian syndrome is quite a kind of conglomeration of multiple symptoms, and
Right.
patients generally present with various types of the signs and symptoms. So,
Right.
what do you think? How we can identify such patients who are having some psychiatric illness, and what is that point where gynecologist or any other physician, treating physician, should recommend it to the psychiatrist? Is there any specific signs and symptoms?
See, we all say one common thing in psychiatry. Once the starting symptom, when you identify that your sleep is being hampered, your mood is not the same and as it was, you either being having too much anxiety, too much of low mood, or any kind of anger related or frustration related issues. These are the initial points which one can recognize that I was able to cope up with my stresses in life, but now there is a slight difference that my functioning is being impaired. Functioning, by functioning I mean psychosocial functioning, your occupational functioning, your personal functioning. Ki I am not feeling the way I am supposed to be, I am not able to work. I am not able to feel the way I always do. I am not able to perform my regular core activities as I am supposed to do. These are the initial few symptoms: decrease in sleep, any change in appetite, any change in behavior, any starting of any mood symptoms which is disturbing you. And we all know that endocrinological disorders do have mood symptoms at the very start of the endocrinological symptoms. We do have mood symptoms. This is where a gynecologist can recognize, a female herself can recognize, and do not feel stigmatized to visit a psychiatrist along with the gynecologist.
Very well said, ma'am. Very, correctly said. So, can you give us more about how generally these patients are managed at the level of psychiatrists? What is the
Right,
importance of having some diet, exercise, or psychiatric counseling if it is
right,
available? Can you more elaborate on this?
right. See, theme this time of PCOS is very nice. They do understand the uh, concept of psychology behind of a woman behind suffering from PCOS. They say, light, let's fight, never. They say never. Uh, I mean, the theme, as you already know, this time is never choose indifference. Choose to fight. Cannot be indifferent to your symptoms of PCOD. Never choose that indifference. That chalega. कोई बात नहीं, सिम्टम्स ही तो हैं, गायनी कंडीशन ही तो है, हार्मोन्स इम्बैलेंस ही तो है. यू नीड टू फाइट, यू चूज टू फाइट इट. अगर आप यू फाइटिंग फॉर इट, सिर्फ आप गायनाकोलॉजिकल कंडीशन को नहीं फाइट कर रहे हैं. यू विल बी मैनेजिंग योर पीसीओएस, you will be managing your uh, diabetes, you will be managing your stress, you will be managing your psychiatric disorders. By psychiatric disorders, I don't mean just depression and anxiety. I also mean body dysmorphic disorder, OCD, substance use, drug dependence. I also mean personality disorders. I also mean borderline personality. I also mean bipolar affective disorders. I also mean psychotic disorders, severe psychotic disorders. As I have already told you that DHEAS has GABA inhibitory effect. So when there is very less GABA agonistic effect. So when there will be decreased GABA in the body, increased testosterone in the brain, there will be aggression as well. There will only not be anxiety or depression. There will be aggression as well. So depends on the situation of the patient and the severity of the illness. We need to interview the patient as a psychiatrist when the patient is referred to us, and see whether counseling is important or medicines and counseling both are important. And weighing the pros and cons of the medications, we need to start the medications with the consent and with the liaison of patient and her husband.
Great, ma'am. Thank you. So, what is your concluding remark? In brief, can you give us gist of all this? Any advice to the
Yeah,
patients?
yeah. I will always say this. जो इस साल की थीम है, नेवर चूज इंडिफरेंस, चूज टू फाइट. आपके साथ कोई भी कंडीशन होता है, आप उसके साथ इंडिफरेंट नहीं हो, उनसे इग्नोर नहीं कर रहे, उससे फाइट कर रहे हैं. आपको सिंपल ये समझना जरूरी है, जब आपको पीसीओडी है, वो ऑलरेडी आपके स्ट्रेस लेवल्स को बढ़ा रहा है. अगर आप उसको ट्रीट नहीं करवाएंगे, आपके स्ट्रेस लेवल्स और बढ़ेंगे, और ज्यादा स्ट्रेस लेवल्स ज्यादा पीसीओडी को एग्रवेट करेगा. तो आप, यू नीड टू नो दिस fact that all gynecological conditions, including PCOS, has correlation with your stress, and you need to fight it with the help of a professional, mental health professional. And we are there for you,
Okay.
always there for you.
Yeah, yeah. Thank you, ma'am. Very nicely said. So here we'll wind up our session. Thank you for being here and giving us this important, valuable information. Thank you, ma'am.